Let's bring in MS Now's Josh Einiger and epidemiologist Anne Rimoin. She's a professor at the UCLA Fielding School of Public Health. Josh, first, what is the status of this ship this morning?
Well, the ship, Anna, is motoring its way into its destination in the Canary Islands in Spain, and actually people there are not thrilled. And we can show video right now of protests that happened this morning in the Canary Islands as people are trying to prevent the disembarkation of these passengers from this ship. Look, Anna, we've been through this. We've all seen this movie before with COVID, and it's definitely a different virus, but it certainly raises questions about how things work now in terms of virus prevention on a ship 6 years after COVID. We can show you the route that the ship took. It departed April 1st from southern Argentina, and then the first passenger died on April 11th. But then it was about a couple weeks after that that they stopped and allowed people off the ship. About 24 of them were allowed to disembark and then travel to wherever they chose to go. And it was only about a week after that that a passenger was actually diagnosed, and there was a case that was confirmed with Hantavirus. But, you know, none of the passengers who disembarked provided any kind of contact tracing, were asked to do that. And so it's been up to health authorities to try to track them down. At least 8 of those people are Americans in 5 different states across the U.S. They are said to be doing okay, but it's, of course, very concerning.
Professor, as I understand it, this is a rare strain of hantavirus, the Andes strain. People are, of course, scared as we see these protests in Spain and in the Canary Islands. What do we know about this particular strain and treatments?
Well, this strain, the Andes strain, is the one hantavirus that can actually spread from person to person. And so that's why we're doing all of the contact tracing and making sure that we understand who has potentially been exposed, and either isolating those people who are sick, quarantining those people who've been exposed here. In terms of treatments, it's supportive care. And the earlier that you can get care to somebody who becomes symptomatic, the better the outcomes are likely to be.
Josh, what do we know about the origin, how and where people contracted this virus?
As far as I know, that's still a mystery. We're waiting for authorities to provide that information. I mean, it was somebody who was on the ship, whether it contracted it at the origination point in Argentina, or perhaps it was on the ship already, a crew member. That much is unclear as far as we know. We do know that the National Institutes of Health, the CDC, put out a statement basically suggesting that Americans are not in any danger through all of this. There are 5 states right now that are monitoring. There's the statement. The risk to the American public there at the bottom there is very low, according to the director of the United States National Institutes of Health. Those are the 5 states. You're looking at there: California, Arizona, Texas, Georgia, and Virginia. California has at least one, but some number of people that have not yet confirmed. The other states there are 2 states with at least 2 people who came off that ship. But again, we're told that they're okay and they're quarantining, but it does raise a lot of questions about how the system works after all we learned, several years ago.
Right. Professor, what steps are now involved in contact tracing, and how concerned are you about further spread?
Well, the next steps are putting the puzzle together of exactly who has been in contact with the cases that have been confirmed, with the suspected cases, and understanding what those exposures were and really stratifying people's risks. And so I think that the key here is we have a disease that is contagious. It's something that certainly can spread from person to person. But the real concern here is those people who've had direct contact. This is not a virus that spreads as easily as something like COVID or something else. So I think that that's the real the real point here, is that just because we have a disease that is contagious doesn't mean that we have the same kind of pandemic threat that we would have had with COVID or another respiratory virus.
I know, I think a lot of us are remembering the beginning of that COVID-19 pandemic, and there was at the time an overall lack of urgency and concern. A lot of countries applied the wait and see approach, but this time around, the WHO has been vocal in saying this is not another pandemic or epidemic situation. Can they be so sure?
Well, these kind of outbreaks certainly are important to control, but this is different than COVID because, first of all, we know this virus. We're not starting from ground zero. We do know this virus. We do have, although limited, information on how it spreads. And it does not seem to have the same capacity to be able to spread from person to person in extended chains and be able to sustain itself the way that a virus that would have pandemic potential does. You know, we have many viruses. We have outbreaks of viruses all the time. I think that the issue here is we have this PTSD of an outbreak on a cruise ship, and what does this mean, and another spillover. You know, to me, the issue here is, do we have the capacity to contain this? Yes, we do. Do we need to continue to have strengthened public health systems? Yes, we do, just for these situations that we're seeing right now.